evening. Welcome to a brand new episode of BMC Global Live, AlHilal Health World, Nothing But Lifestyle. I am Jasmine Mujib. In each episode of this talk show, we bring before you an expert doctor from AlHilal Hospital to discuss your various health issues. Today the topic of discussion is diabetes during pregnancy. Diabetes during pregnancy is a condition, if not managed properly, may lead to many birth defects for the child and also may lead to many complications for the mother. So, to discuss this topic in detail, we have with us Dr. Jasmine Sankaranarayanan from AlHilal Hospital, Salmabad. She is a specialist in obstetrics and gynecology with an experience of over 13 years. To throw more light to the topic, let's welcome Doctor to the show. So, Doctor, welcome to the show and thank you for being with us today to discuss this topic.
Hi, thanks for having me.
Hi, Doctor. So, Doctor, how does diabetes occur during pregnancy? Please explain for us.
Diabetes, other than having risk factors, is a complication of pregnancy. The reason being, there are certain hormones which are being produced in pregnancy in excess. These hormones are beneficial for supporting the pregnancy, and these hormones are being produced by the placenta in the second half of the pregnancy. So, coming to placenta is an organ that connects the mother and the baby, and it is it's responsible for providing nutrients from the mother to the baby. So, when this placenta is producing such a huge amount of hormones, the only problem with this is it being anti-insulin in effect. So, as we know, we need insulin to bring down our blood sugar levels, to control our blood sugar levels. So, when these hormones are all acting against insulin, a person will have to produce at least 3 times the normal amount of insulin we are usually producing to get the blood sugar in control. So, some people, at least a part of the women, will be able to produce this much amount of insulin and avoid getting diabetic in pregnancy. But the ones who are not able to do it will become diabetic in pregnancy. And it happens somewhere around 24 to 28 weeks of pregnancy.
Mm-hmm. Okay, Doctor. Then I would like to know who all are prone to diabetes during pregnancy.
So, there are some people who are prone to diabetes, like we have some certain risk factors. We call it the non-modifiable risk factors and modifiable risk factors. So, the non-modifiable is of course our genes, we cannot modify it. So, there is a role for genetics to play in this. There will be women who are having a family history of diabetes, and according to our ethnicity is also responsible to some extent. So, we have seen that the women in Asia and Africa are more prone to developing diabetes in pregnancy, compared to certain other races. Then the modifiable risk factors like being overweight, obesity is a very important, very common risk factor for developing diabetes later on in life. And we are seeing that polycystic ovarian syndrome, PCOS, is coming up in many women are suffering from this problem. And this problem is also a hormonal disorder, and it can cause diabetes later on. Then we have other things like I said, family history, overweight, and also we have to also get a detailed history from the patient regarding if she was having a huge birth weight baby, heavy birth weight baby in the previous pregnancy, or a difficult delivery due to a overweight baby. So, these all are pointing towards she having had diabetes in the previous pregnancy. Maybe she is not aware of it, maybe she has not been diagnosed of it, but we have to look out for such pointers so that we can be more, give her a close monitoring in the present pregnancy.
Okay, Doctor, what are the symptoms we should look for during pregnancy if we have to find out that she has diabetes?
Unfortunately, we don't have any specific symptoms in pregnancy. The thing is, the commonest symptoms of having diabetes is when a person is having the person may have increased thirst or too much fatigue, nausea, increased frequency of maturation. So, these all are kind of non-specific symptoms which are even there otherwise also in a normal pregnant woman. But that cannot point to diabetes. So, we cannot go by the symptoms. As I said, we have to get a detailed history to see if she is going to develop diabetes. She is having more chance of developing diabetes in pregnancy, and we follow the universal protocol of universal screening for all women, all pregnant women for diabetes.
So you mean everyone should go for diabetes screening?
Yes, definitely.
Okay. So as there are no symptoms, how do we diagnose that a lady has diabetes?
So we, like I said about the universal screening, any woman coming into our clinic, she is pregnant, we, in the first antenatal visit itself, we suggest her to do a random sugar test at least. That is the minimum, that's the basic test we can do, and that is the first test we will do for any woman coming into the first time, right? So by the random sugar test, we have to see if it is a very high value. There are certain fixed values by which we can say if it is normal or she is going into the diabetic range. So there are two kinds of diabetes like we have to look out for. One, as we said, we are talking about is the diabetes in pregnancy, and there are women who are already diabetic and have not been screened before. She's not aware of it. She just comes into your clinic, you do a sugar test, it's very high. So that is what we call pre-gestational diabetes. We have to also look out for that because that is associated with more complications for the baby and the mother. So that is the first test we are doing is in the first visit. We see her, that is just a random sugar test. If it is found to be high, we have to also do another specific test which is called HbA1c. Okay. So the importance of this test is to know if it was just a random test. Some person must have just drank a bottle of juice or something or a chocolate and come and given that random test. So we don't know that. So to know if her previous 3 months sugar level has been in control or has been in a higher range, we go for HbA1c. So that gives us a better idea about what has been her sugar control in the past. Then we come to the glucose tolerance test that is done at 24 to 28 weeks. So this is a specific test for pregnancy. And then thereafter, even in the 3rd trimester, we should do a blood sugar test for any pregnant woman.
Okay, now you mentioned about the glucose tolerance test. Can you make it more clear for us?
So the glucose tolerance test is a specific test in pregnancy, and as the name, the word implies, the glucose tolerance, we are seeing how well a pregnant woman can tolerate the glucose load. So what the concept of this test is that we give a load of glucose for her. She has to be coming in fasting when she's doing this test. It is done specifically between 24 to 28 weeks because, as I said, the hormone levels are at its peak at this time, and this is the time we want to check if her insulin levels are good enough to control the blood glucose level. So we advise her to come in fasting. She will be fasting for 8 hours on the previous night. She can come early morning, give a sample for fasting blood glucose. After that, we advise her to drink 75 gram glucose mixed in water or juice, ideally water. Water would be better. And she cannot take it all at one go because that can cause too much nausea and vomiting. We will have to even cancel the test. So we advise her to take it as sip by sip over a period of 10 minutes. And after that, after 1 hour and 2 hours of drinking that glucose, she has to give her blood test again. Only after that she can take a breakfast. So there are a set of prefixed values by the association. According to American guidelines, there is a set of values. According to the Indian diabetic study group, there is another set of values. We compare her blood sugar values with those set of values and then decide whether it is in the normal range or she needs further testing or not.
So that is glucose tolerance test.
That is glucose.
So doctor, once a lady is diagnosed with diabetes during pregnancy, what are the treatment options you go for?
So we will go through these values. We will see if it is abnormal. If the values are abnormal, so when I said about the random blood sugar or the glucose test, when the values are showing extremely high values, so that directly shows that she is not gestational diabetes. She is a pre-gestational diabetic. It's very high. So in those
that means
situations,
she had diabetes before also.
Yeah, that is what we can conclude from those values. You know, if it's extremely high, the 2-hour blood value is more than 200 and all. Such extreme high values, we have to directly consider giving insulin. Insulin is the medicine of choice in diabetes in pregnancy because there are some oral tablets also like metformin and glyburide and all these tablets are not very much recommended because one thing that they can, to some extent, they can cross the placenta. They are safe only, and to some patients who are having only a mild increase in the blood sugar, we are giving these tablets. Especially there are patients who are not compliant with insulin. They want to avoid insulin. They are afraid of taking it. So maybe to a certain set of patients, we can give these tablets. But insulin is always recommended, especially if you are having pre-gestational diabetes. But when there is a gestational diabetes in pregnancy, so we know that it's developed only by 24 or 28 weeks, it's come up, and it's the sugar levels are slightly high. The first and foremost thing we need to recommend is diet and exercise. Okay? So diet is what we call a diabetic diet. And exercise is the other two things. These are the two main things we will recommend, and we will monitor her. We will ask her to follow these two things strictly for 1 to 2 weeks. After that, we will be checking her blood sugars again to see if it's under control. If it's not under control still, we will have to go for insulin.
Now you mentioned about the diabetic diet. Can you explain it in detail for us?
So diabetes, any patient with diabetes, the problem is the high blood sugars, and the high blood sugar is coming from the high amount of carbohydrates in our diet. So that is the first thing we have to focus on. We have to focus on reducing the carbohydrate level in our diet. So what we suggest our pregnant women is that they can take 3 meals, 3 big meals and 3 snacks a day. Okay? And the 3 big meals, it should be a healthy plate. So a healthy plate will have 50% carbohydrate, means half of the plate will be carbohydrate, whatever you're taking, if it's chapati or rice. Rice, we usually suggest to take brown rice only, because white rice is said to be like increasing the glucose levels. There will be sudden spikes. So these are the, that is the carbohydrate we are telling. And then quarter of the plate should have vegetables, salads should be there, because salads are having very low sugar values, low carbohydrate values, and it's better to avoid the starchy vegetables also. There are non-starchy vegetables like leafy vegetables, broccoli, spinach, these are good. These are good to control the blood sugar levels. Then the other quarter of the plate can have any other your protein food, protein part of the food. So that could be maybe chicken or eggs or something like that. It's always best, there are certain foods we tell them to avoid. So that should be processed foods like pasta, white bread. All these are very, very high in their carbohydrate content. So that should be avoided. Then the other thing, salted foods, fried foods, oily foods. These should be ideally avoided, and the too much sugary drinks and all. Even fruits to some extent should be restricted in diabetic patients, because they are also, they just spike up the sugar levels, right? Especially the too much sweet fruits, we generally tell them to avoid a little bit, like mangoes and bananas. They can of course take something, a small portion of fruits like apple or grapes, guava. These are okay. But it will have to be restricted a bit. And it's always good to take fruit as a whole rather than take it as a fruit juice, because juice will be devoid of all the fiber and it will again spike up the sugar values.
Now you have explained about the diabetic diet. Can you explain about the role of exercise in controlling diabetes in pregnancy, and what type of exercise you prefer?
Yeah, this is one very common doubt everybody have, that do we need to exercise, and their majority of the patients are a little afraid, a little skeptical when it comes to exercise. They feel that that can badly affect the pregnancy, but no, that's not the case. Only thing is, we have to, there are certain exercises we will avoid in pregnancy. It will be more light and will be good enough, because exercise is very important, just like diet. Restriction, we are adjusting exercise to regulate the blood sugar levels. So avoid that excessive eating that can happen if we stay sedentary. So the exercises we are recommending is stretching exercise, yoga. Then we have this stationary cycling, aerobic exercise, and of walking. Walking is a for women, and we suggest all women to a bit after a meal, because meal that spike can be controlled with that walk itself. So some prefer to walk, okay, some like for 30 minutes. It's your thought. If you have a good endurance, you can walk for that much time, and if you're tired, you can stop. And so the recommendation is like at least 20 to 30 minutes, 3 to 4 days a week.
Okay. Now coming to the important part of our discussion, the renal complication of diabetes during pregnancy. I know about the complication.
Of course, the fetal complications, the to the babies, but we first to the maternal complications. So, the thing is, if she's diabetic, she is more at risk of getting high blood pressure also in pregnancy, hypertension. There's more tendency for getting obese, overweight, so that can result in other complications also, especially a woman with diabetes. Any woman who has had diabetes before pregnancy has to be monitored for other organ damage also. We will be doing every 3 months, we will be doing a kidney test and the examination. All organs get affected with a prolonged diabetes. So things, complications can happen with diabetes for the mother. She can go in for early abortions if she is having diabetes even before pregnancy and it is not controlled. There's a very high risk for her to go in for abortions, recurrent pregnancy losses. And the other complication could be, yes, we have discussed about the hypertension, and there could be bleeding in pregnancy and also during delivery. The problem with the high uncontrolled blood sugar is that it can also make the baby have an uncontrolled blood sugar, high blood sugar, that will cause an increased urination of the baby into the amniotic fluid. So the amniotic fluid inside the womb will be much increased, causing overt stretching of the womb. The pregnancy, the uterus becomes very stretched out, and that can result in a premature contraction, premature delivery, and after delivery also the uterus will fail to shrink back to its the regular postpartum size. The post-delivery size, it will not shrink properly, and that can result in excessive bleeding after delivery. Then during pregnancy also, diabetic woman with uncontrolled blood sugar is highly prone to developing vaginal infection, urinary tract infection. These are the regular complications we see in the mothers. For the baby, the risks are very high. As I said, it can go in for an abortion if it's an early pregnancy with diabetes. Then the baby, the 4 to 8 weeks, that is the time when the baby's nervous system is forming inside the womb. So that is even before the mother comes to us for a visit, for her first visit. And if her blood sugars have been uncontrolled during that period, the baby can have serious organ damage, too many birth abnormalities. Like the most common we see is heart defects. The baby can have heart defects and major ones that can result in death later. Then the other thing is the overweight baby. Large birth weight will be there, so that can cause delivery problems. We will not be able to pull out the baby. Due to the high sugar level, there will be too much fat deposition in the shoulder of the baby. So at the time of a normal delivery, vaginal delivery, it is difficult to deliver the baby out. The shoulders get stuck, and that can result in birth trauma. There can be a shoulder fracture, also asphyxia. There will be respiratory distress in the newborn. These things happen when the baby is overweight. Other than that, even after delivery, if the baby has been born because of the uncontrolled blood sugar, sometimes we have to deliver out the baby early by even before the due date, by 37 weeks and all. If we are delivering the baby, that can cause respiratory distress in the baby because the lungs wouldn't have matured by that time. The high blood sugar will also, delay the lung maturity of the baby. There can also be too much hypoglycemia. That is one very common complication seen in the baby after delivery, because when the baby is delivered out, automatically the sugar levels drop, but the insulin levels continue to be high. That causes a low blood sugar, and the baby has to be monitored for a couple of hours and given proper feeds also, so that it doesn't suffer from the complications due to the low blood sugar.
So can we prevent this condition, diabetes during pregnancy?
The thing is, like we said, the modifiable factors, of course, we have to try and prevent. The genetics we cannot control that, so that's not in us. But we know our lifestyle, the food habits and all. It is a bit bad in some of our, in a huge part of our population, right? So everybody should be aware that these could be the complications that will face in pregnancy. So with that awareness, if they work out, to some extent we'll be able to prevent it. But yes, we see diabetes in pregnancy even in very, very physically fit patients. That is also there. So that we cannot say that we can prevent it completely, but at least we can keep it under control and reduce the complications to a great extent.
Okay. Another common query is if a lady has diabetes during pregnancy, is it lifelong for her?
So the thing is, after delivery, 50% of the ladies, they will go in, their blood sugars come back to normal very quickly, immediately after delivery. We after delivery on the second day or third day, if we are monitoring the blood sugar levels, for most of the women, it would have come back to normal. But the problem is that they may need monitoring for a longer time because according to studies, at least 50% of the women go in for a lifelong diabetes. Okay. So what we do is we monitor, we check a blood sugar level within 48 hours of delivery or by 72 hours of delivery. Again, we ask them to come back for a visit at 6 weeks, 1.5 months. That time we again check, and again at 3 months we again ask them to have a checking of the blood sugar. And it's better to check every year. That is the best thing to do because we don't know who is going to have diabetes later on.
Okay. Are they prone to diabetes in their later life?
Yes, they are. That's what I said. At least 50% will develop diabetes later in
their life.
Yeah.
Okay. Thank you, doctor, for giving us a lot of valuable information. Any advice from your side for our viewers about your topic?
Yeah. So that should be our funda, that prevention is better than cure. So all of us should be aware. I want all ladies to be aware of this condition, diabetes or hypertension. This is happening more often due to our own lifestyle conditions. So we need to correct whatever we are doing wrong. And all ladies should come for a preconceptional counseling. That is very, very important. Even now, to some extent, I don't see many patients coming in for that because usually it's obviously we'll feel that only when we are pregnant we need to go to a gynecologist. But what I advise everybody is they should come when they are planning the pregnancy. They have to come and visit the doctor so that she is able to take a detailed history, do the relevant blood tests, find out any condition you are suffering from. It may be a sugar problem, it may be a thyroid problem, whatever it is. A treatment can be started upon so that the baby doesn't suffer from the later complications.
Okay, doctor, thank you. Thank you for being with us in your busy schedule and spending a lot of time with us and giving us a lot of information. I'm sure the viewers will find it very helpful. Thank you once again. So viewers, I hope this was very informative. As doctor said, prevention is always better than cure, and following a healthy lifestyle, we can keep diabetes during pregnancy at bay. So, see you all in yet another episode of BMC Global Live, AlHilal Health World, Nothing But Lifestyle. This is Jasmine signing off. Good night.